Hi all, welcome to my channel. Today we are going to learn about the test of red blood cell count. Purpose of the test, what does the test measure? And interpreting test results. Red blood cell count is a blood test that measures your levels of erythrocytes. This test is most often done as part of a complete blood count that also measures other types of blood cells. RBC count can help diagnose anemia and other conditions that affect red blood cells. Let us see about the purpose of the test. The purpose of the RBC count is to find out if the number of red blood cells you have is normal or abnormal. Now, what does the test measure? RBC count is the number of RBCs contained in a sample of blood, usually expressed as millions of cells per microliter. In a complete blood count, RBCs are measured along with white blood cells and platelets. These cells are made in the bone marrow and released into the bloodstream as they mature. In the blood, these cells are suspended in a fluid called plasma. Blood consists of 45% red blood cells, less than 1% white blood cells and platelets, and 55% plasma. RBCs contain hemoglobin, a protein that binds to oxygen. In this way, RBCs carry oxygen to the body's tissues and carry carbon dioxide from the tissues to the lungs to be expelled. Next, what are the procedures for taking an RBC count test? The RBC test requires a blood sample. Most often, blood is drawn from a vein in the inside of the elbow. No preparation is required before having this test. Some medications can affect red blood cell count, so make sure the doctor who ordered your test knows about all of the prescription and over-the-counter medications you are taking. There are several steps involved in the blood draw for a RBC count or CBC test. The puncture site on your arm is cleaned to kill any germs and prevent infection. An elastic band is tied around the upper arm to apply pressure so that the veins swell, making them easier to locate. Making a fist also helps to make the veins swell. A needle is inserted into a vein. The blood flows into a vial or tube attached to the needle. Sometimes more than one vial of blood is needed if multiple tests are being done. The pressure is released on the upper arm and the elastic band is removed. The needle is taken out and the spot is covered with a bandage to stop bleeding. After the test, once the blood draw is complete, a piece of gauze or bandage is placed over the spot where the needle is taken out. You may be asked to apply gentle pressure to help stop any bleeding. This may also help prevent swelling and bruising. How can you interpreting test results? RBC count is written as a number value in cells per microliter. The normal range for red blood cells depends on factors like age and sex. RBC can also be affected by elevation in the area where testing is conducted. Because multiple factors can affect RBC count, it's important to talk to your doctor to understand what your test results mean. Normal value ranges may vary slightly among different laboratories. Some labs use different measurements or test different samples. In general, reference ranges for adults typically fall between 4 and 6 million cells per microliter of blood. If the range of RBC either higher or lower, you should consult your doctor. See you next interesting lesson. Thank you for watching.